Dr. Lisa Palmer, Dr. Mama Bear, coming to you live from Florida on clot shots, concussions, and kitty cats and cats. So 3 different topics. As a natural health care provider, as a doctor of chiropractic, as a holistic practitioner, we have seen responses from the vaccines that they received. And so what does that look like? It looks like unexplained weight gain. It looks like puffiness in the face. It looks like tight-fitting clothes. From an autoimmune standpoint, it looks like Hashimoto's thyroid. It looks like Epstein-Barr flare-ups, herpes simplex. It looks like chronic inflammatory type of responses. And so what do you do with that? Is there anything that can be done to undo that? I would like to say yes. I can say that anything that causes inflammation will make it worse. So inflammation, you can think of it as like fire in the body, will be increased by the consumption of sugar. So eating those chocolate chip cookies, following that up with some ice cream, chasing it down with some alcohol, any type of sugar or fermented alcohol can increase inflammation. Also, any type of fried foods. So your French fries, your fried chicken, your double fried steak, those types of things are inflammatory due to the oils. If you're a smoker, smoking increases inflammation, right? The chemicals that are located on the tobacco or in the paper of the cigarette are also inflammatory. And I would put vaping in the category too. Like vaping, you're inhaling chemicals straight in the lungs, just like the cigarette industry has been sued for causation of cancer and has labels on the product warning of cancer risks. The same thing's going to happen in the vaping community. Why? I don't wish this on anyone, but why? Because chemicals are being inhaled straight into the lungs. So it's going to have an inflammatory response. And so these are big problems. So what can you do? You can avoid inflammatory foods. So you can avoid the sugar or do less of it. You can avoid the fried foods or do less of it. You can do less smoking or quit, right? So that would decrease inflammation. The more chemical toxicity that is introduced to the body, whether it's injected in the body, it is consumed on our food or breathed in the air, that also would increase inflammation. And so it's really interesting. I have patients that participated in the injections, and they have very clear signs that things had changed since then. So what does that look like? It can look like what I was talking about, the increase in inflammation in the body, the increase of autoimmune type conditions. It also can look like weird heart problems, right? So increase in rhythm, increase of heart rate, irregular rhythms or palpitations. So you shouldn't feel your heart. Now, yeah, if you ran down the street, you're going to feel your respiration increase, you're going to feel your heart rate increase, but you shouldn't feel irregular rhythms and you shouldn't feel your heart race. And so many patients reported those types of symptoms. And in one case, so badly that I had to refer her to a cardiologist because she was just experiencing irregular rhythms, and the cardiologist had trouble figuring out why. Problems breathing, so that can occur, shortness of breath, asthma, coughing, all those things can be related to that. So what can you do? You can increase your vitamin C. I don't know your health history, but vitamin C can help with inflammation in the body. It can help with free radicals in the body. You can look for natural forms of vitamin C like gooseberries or golden berries, oranges, strawberries, any kind of berry. Acerola berries have a very high concentration of vitamin C, and they even grow in Florida, which is awesome. It's funny, I have an acerola bush in my front yard, and I really thought last winter it died because we had a frost, and I'm like, my poor acerola tree, that's it. I thought I covered it. I might even covered it and left the cover there because I forgot, but it looked dead. And then this spring it is back. This is like the bush the acerola tree or bush that doesn't die, because it looks like it's done this multiple times. But the red berries, acerola, has a very high concentration of vitamin C. So look to see where you can look to see where you can increase your C to decrease inflammation. Look what you can do in your daily routines to decrease inflammatory food. So I'll admit, back in the day, Chick-fil-A was on my way to work. So I was like, well, it's chicken, it's protein, it's healthy, right? So I was like, okay. So I would stop in and get a chicken sandwich because it was convenient, right? Did it save me time? One of the excuses I gave myself, right? I'm not perfect. I gave myself was it saves me time because I go through the drive-through. But depending on the line in the drive-through, are you really saving time? So I would have the fried chicken sandwich with the biscuit, with the coffee, with lots of sugar in it. That's a very inflammatory breakfast, right? And what could you do instead? You could boil some hard-boiled eggs and grab one of those in the morning. You could have whatever you would eat for dinner. You can have that in the morning. You can make a shake. There's so many different options. The difference between grabbing something on the way to work and having something in the morning is just preparation, right? And so a successful thing that I do is every single week, I go to the grocery store and I have food for breakfast. I make sure my family has food for breakfast. I make sure my family has food for dinner. Most of us have lunch out, but we have healthy food options. And when you have those healthy food options, you're more likely to eat them because they're in your refrigerator. If your refrigerator is bare, then you're more likely to end up in a drive-through for breakfast or lunch or dinner, or order DoorDash or order Uber Eats, which I admit I've done it too, right? But if the majority of your food is coming from restaurants, it can be inflammatory due to the oils that they use in cooking. Another hot topic that very much is ignored, not paid attention to, skipped over, looked at as a badge of courage are concussions. And so I played high school, college, and professional sports. When I worked with college sports and when I worked with professional sports, there was different viewpoints along my career where I was on sidelines for almost 30 years. Some of the viewpoints were, if you get hit in the head, right? So if you take a hit to the head, I worked a lot of soccer. I worked a lot of college football. I worked a lot of Super League rugby. I worked college ice hockey. And there's a viewpoint at one point in my career was if you got hit in the head, you shake it off. If you see birdies, oh well. And concussions weren't really taken seriously because that was the mindset. Like in football, you're going to get hit. In soccer, you're going to get slide tackled. In ice hockey, you're going to get in a fight. I mean, out of all the sports I worked, ice hockey, you guys fight a lot, whether it's smashing someone into the boards or dropping your gloves or whatever. Ice hockey players, they can fight. And even in rugby, the nice thing with rugby is rugby players don't use their equipment as a weapon. So in football, if you use your helmet to tackle someone, that's called spearing. And if you hit with your head, that is not good for your neck or your head. And when you get tackled or when you tackle someone, it's like a whiplash injury. And so there was a stat out there that said, in a typical football game, there are multiple car accidents or head injuries, whiplash type injuries in football. If someone has a whiplash, so you're driving down the street and someone rear ends you, your head goes forward, your head goes back, and you don't have to hit your head on the windshield. You don't have to hit your head on the headrest. Just the motion of getting smacked from behind can cause a concussion type injury. A lot of times where the concussions are from a slip and fall, hitting your head on ice or snow or a hard surface, whether it is from a car accident, getting rear-ended or getting side impacted, whether it comes from sports, whether it's soccer, basketball, football, rugby, ice hockey, whatever it is, oftentimes concussions get overlooked. They get missed. The athlete doesn't want to communicate, or the patient doesn't communicate that they hit their head. They don't want to communicate that they kind of got woozy. Like, you shouldn't get woozy. You shouldn't have blurriness in vision. You shouldn't have blackness in your vision. You shouldn't have a headache. You shouldn't have nausea. You shouldn't have vomiting. You shouldn't have unequal pupils or a sensitivity to light, right? So those are all signs of potential concussion. and they're very real. So I played soccer. I played professional women's football. I got concussions in both. I get concussions riding my bike. And one of the last concussions I had, I was playing soccer, and one of the girls on the other team kicked the ball directly at my face. She was maybe 2 feet away from me, 2 feet in front of me. I don't know why. It was called clearing the ball. So she was trying to get it out of the defensive area. And I was in front of her because I wanted to get the ball from her. And I don't know why, full force, she aimed it at my face. Usually you take it to the side and you pass it that way. But yeah, she full force smashed the ball into my face and I had a concussion. Now, the doctor in me, and being on sports science for decades, was trying to evaluate myself. And if you have a concussion, you cannot evaluate your own concussion. And I went to one of my colleagues in town and I was like, yeah, I think I'm concussed. And I had problems. I had headaches. I had problems recalling words. I had problems concentrating. These are all signs. And so with quantum nutrition testing, which is the technology we apply nutritionally to our patients and clients, we can work on an old concussion. We can work on a fresh concussion. We can look to see what nutritional support, so the brain likes specific nutrition, what nutritional support can help enhance brain function, what nutritional support has been shown to help with concussions, what nutritional support in herbs can help with cognition and memory, what nutrition and herbs can help prevent nasty things down the road like Alzheimer's and dementia. And so there are very, very few practices. There are very, very few healthcare offices that I'm aware of that do concussion work. And we at Palmer Natural Health, we do concussion work. In quantum nutrition testing, I teach my students concussion work. It is very, very, very important. And so if you had a concussion and no one ever did anything about it, if you had a fresh concussion, definitely get it evaluated. Because the negative effect of those injuries is cumulative. Old school rule, some people apply this, some people don't. They say 3 concussions and you're done with contact sports. I've had 4, right? Why? Because the injury is cumulative. There's things that can be done naturally to improve memory. There are things naturally that can be done to improve concentration. One quick tip is you're having trouble with concentration, eat less sugar, right? Sugar can cause hyperactivity. Look at food labels. Look to see, is there red dye in there? Is there synthetic or artificial dyes in there that have been linked to hyperactivity, right? That have been linked to having trouble concentrating. If somebody's on their phone and they're talking to you, they're not listening to you, right? So decrease screen time. Phones can negatively affect brain function. Phones can negatively affect children's ability to think, can negatively affect brain development. I was at dinner last night and there was a family next to me and it broke my heart because the whole entire dinner, the kid was like this. He was a cute little kid, maybe 4 years old. His mama was playing something on the phone to distract him during dinner so mom and dad could have a dinner. I totally understand. And he was like this the whole entire dinner, with his face in the phone, not interacting with his parents while he was eating nachos and synthetic yellow cheese, right? So feeding him crap, keeping him in screens does not lead to good things, In fact, if you have an injury or you have a concussion or you have a developing brain, blue light and screens constantly in their face has negative effects, has developmental effects, can socially deter growth. And then we go to cats. So quantum nutrition testing is applied to humans, but quantum nutrition testing, which allows us to help locate the cause, help locate the imbalances in the body, can also be applied to cats and dogs and other animals. And so with cats, cats tend to have urinary issues. Cats do not do very well on kibble. Cats tend to be dehydrated, and that's why they have kidney issues. And so very, very interesting when you start to study the veterinarian world, when you start to look more on how the human things we know in natural healthcare translate to the pet world. I mean, just go to the grocery store. So you guys can look at some of my posts. Just go to the grocery store and read labels. So you read labels for yourself with human food. Check out the labels on pet food labels and look at the same kind of things that are not good for humans are also not good for cats and dogs, like soy, like high fructose corn syrup, like propylene glycol, also known as antifreeze, like red colors, right? All of these things are found in the pet food industry as well, and also just like in the human world, have negative effects on in the pet industry, in the cat world, in the animal world. All right. Robin likes eggs for breakfast or chicken sausage. That's awesome, Robin. Or leftover chicken. That's cool. So that works. Yeah, you can eat leftovers. Some people will cook extra dinner and have that for breakfast. Some people like to fast in the morning. Fasting can be very, very good. And just start your morning with water with lemon. And that would be good to rehydrate the body because you do dehydrate at night, so you're sleeping 6, 7, 8, 9, 10, however many hours with no hydration. Some of you guys are sleeping with your mouth open and you're drying out everything. You don't want to sleep with your mouth open. It's not good for oral health, and it's really not good for your spouse that's hearing you snore. And you're dehydrated in the morning. So start your morning with high quality water. Not city water, because city water has chemicals, heavy metals, pharmaceutical residues, toilet paper particles, and the like, and parasites. Well, hopefully not parasites. So start your day with good quality water, minimally carbon filtered. A little bit better would be, and instead of carbon filtered, you could get a whole house filter to remove the chlorine and other chemicals. Even better, drinking distilled, because it is going to remove the heavy metals from the water and the chemicals and the medication from the water. But if you're going to drink distilled water, then look to add minerals in or spring water. Okay, cool. All right. So questions for me on any of these topics? Anything you want to ask me, I'll hang out for a little bit and answer questions. So yes, what you eat is very, very important. What you eat definitely has a negative effect or a positive effect on your body. You've heard the saying, you are what you eat. So yes, you eat high quality food, organic food, healthy food. Your body uses those nutrients to rebuild the body. I've had pregnant women, they think it's a license when they get pregnant. They think they're going to get fat anyways. So then they start eating more fast food, more cookies, more candies, more ice cream, hopefully no alcohol, right? But they think of it as, well, I'm pregnant now, so I can just eat whatever I want because I'm going to get fat anyways. That is absolutely not true. You definitely do not want to have problems with blood pressure when you're pregnant. You definitely don't want to have, which that can happen when you eat foods that are not favorable. You definitely don't want to have problems with blood sugar. There's a thing called gestational diabetes. You definitely don't want to have those problems when you're pregnant. And then remember, if you wouldn't feed that food to a toddler or to a young child because it's absolute crap, you definitely don't want to be consuming it when you're pregnant with your baby. All right. If you want to learn more about quantum nutrition testing, at the bottom link, you can go to qntacademy.com and learn all about quantum nutrition testing and become a natural health coach. You can become a natural healthcare practitioner. If you already are a natural healthcare practitioner in the form of a chiropractor, acupuncturist, naturopath, and so on, it is a beautiful adjunct technology to add to your practice. And if you need help with your health, if you need help and you're not quite sure about what to do, you have a symptom, maybe you've experienced a concussion, maybe you have had injections, maybe you have a condition that no one knows what to do with, please reach out to us at Palmer Natural Health. We would be happy to sit down with you and actually get the information from you as far as what's going on with your health, what is the problem, what can we do to help you find the cause, handle the cause naturally, and watch you improve. I'm Dr. Lisa Palmer, Dr. Mama Bear. Thanks for joining me, everyone. Good night.